Do you have someone, a loved one, that you care for, and you're seeing they're struggling with an addiction to alcohol or drugs, and you've been attempting to look for answers, for treatment, and you've been looking online, and there's a lot of resources out there with programs with 20, 30, 50 beds, and somehow they might get lost around in treatment? Look no further. Please call at 877-293-0722 or visit the crossroadsrecoverycenters.com. Once again, the number is 877-293-0722 at www.crossroadsrecoverycenters.com.
Thank you for joining us today on Crossroads. Today we have Executive Director of Crossroads Recovery Centers, Edgar joining us. Today we're going to do our part 2 on panic disorder. Edgar, thank you for joining us today.
Thank you for having me today. I appreciate it.
So to start off with, I'd like for us to recap a little bit about last week. Last week we went into panic disorder and exactly what it entails and how many different symptoms you have to meet to truly have panic disorder, and then also kind of cover briefly what we went over last week about the difference between panic disorder and then just having an anxiety attack. Edgar, did you want to kind of cover our key points from last week?
Well, yeah, one of the first things you have to look at with panic disorder is that it has to be unexpected, or there's no cause for it. So if you're having a panic attack, it's unexpected, you don't know what's going on, which means you have a rush of all these symptoms, or which means probably pounding heart, feeling shaky, dizziness, feelings of unreal, like you're in a dream state, kind of choking sensation, trembling, lightheaded, like you're gonna faint, shortness of breath, thinking that you're going crazy, you're gonna have a heart attack, you're gonna die. And then subsequent to that is after a month or for a month, you've actually are consumed by the idea of having another panic attack. You're not able to do things like drive as you did before, or just create some type of impairments. So that's typically a panic disorder. And normally the symptoms, rise up in 10 minutes or less. But typically you feel this intense sensation of all these symptoms that I've just described, because as we described last week is your central nervous system is up to 2 different sections, the sympathetic nervous system and your parasympathetic nervous system. And when there's a lot of stress or demand, the body or the kidneys are going to release adrenaline and noradrenaline, which is going to activate the sympathetic nervous system, which is said to cause these sensations, these symptoms happen along. And that's what we're looking at is treatment this week, how to provide help for yourself. If you don't have the ability to go to a therapist, we'll give you some basic techniques to learn to kind of minimize the symptoms, but it does not take away the ability, or doesn't actually substitute for you going to an individual therapist. That's one thing I'd recommend. At Cross Recovery Centers, what we do is not only treat alcohol and substance use disorders, but we also try to treat the other section of it, or the mental health aspect of it, or a co-occurring disorder that we call is the panic disorder or the depression. But today we're focusing on panic disorder. So you might come into Cross Recovery Centers for alcohol and drug problems, and then along the treatment you find out, well, maybe there's panic disorder here, maybe there's some form of anxiety. So we're going to treat that also. We're not going to leave that untreated, because we know if you leave it untreated, you're more likely to go back and to use alcohol or drugs, specifically maybe alcohol or other drugs that's sort of like a depressant, and actually will calm the body down and reduce the anxiety temporarily.
Okay, terrific, terrific. I love that Crossroads is kind of an all-in-one treatment, and you guys don't just focus on the drug or alcohol problem. You're able to realize that there's more to the situation that's causing this drug or alcohol problem, so you're treating the core problems as well. So that's terrific. Okay, so diving into panic disorder, and I know you said that this by no means is in a way to substitute, so I just want to repeat that for the audience. This is not to substitute any kind of mental health care that you should still go out and try to get, but this is kind of an extra little thing to maybe assist you or diminish or in some aspect help you with your panic disorder, your panic attacks. So Edgar, if I'm having a panic attack and I start to feel like the pounding heart rate or the shortness of breath and the chest pain, it feels like I'm having a heart attack, but it's actually a panic attack. So what do I do to prevent or to stop that or to lessen that situation?
That's a great question. So what I'm thinking I'm going to teach you is a quick technique. This is not a relaxation technique. This is called breathing retraining. And the first thing I will do with you is teach you how to breathe differently. Because sometimes when we have panic attacks, we actually start breathing in a way that is actually going to encourage or increase the symptoms of panic. So the very thing you're trying to prevent, you're actually going to cause yourself if you do this.
Right, and that makes sense because I'm panicking, so my chest is pounding and I'm trying to catch my breath, so I keep, which is actually making it worse.
Yes, so one of the things to understand is when you're having a panic attack is that when you're breathing, your breathing has to come in naturally in and out. And what your body uses as a marker to activate the parasympathetic nervous system, which is the calming system of your body, is the CO2. Not how much oxygen you come in, but how much oxygen is being released. So what happens if you're dumping a lot of CO2 and exhale, it's not going to activate the calming system. So what you want to do is you want to regulate the breathing. As you breathe in, you're naturally going to breathe out. And the way you do this is as you're breathing in, you count to 5 in your head. And as you're breathing in, you expand your stomach, your diaphragm muscle, like you're filling up a balloon of air as you breathe in. Slowly count to 5. 5, 4, 3, 2, 1. And slowly breathe out. 5, 4, 3, 2, 1. And that's what you want to do. You want to keep doing that for 10 minutes. Because what's going to happen is you're breathing slowly in and breathing slowly out. That's going to activate the parasympathetic nervous system to the natural release of chemicals to calm you down, and also chemicals are going to break down some of the enzymes in your body to calm down also. And also as you're doing your diaphragm breathing, it's also going to expand that and hit a nerve that's going to actually activate the calming system. And the reason you're counting is because typically when you're having these panic attacks or these sensations, you're going to be thinking of all the worst possible outcomes. I'm going to have a heart attack, what's going on with me? So counting to 4 is going to distract your mind at the moment. So you're doing a lot of things at once. And now this is really easy to say to do, but to do is actually very difficult, especially if you're in the middle of a panic attack. The last thing you're going to do is count and breathing in and out. You're going to be like, well, what's going on with me? So one thing I want to let you know is you got to practice this exercise while you're not having a panic attack. So when you do have one, you actually are used to doing this exercise. I typically recommend like a prescription, twice a day for 10 minutes. The more you do it, the better you're going to get at it. So when you have a panic attack, it's going to happen. If you try this technique too early on without actually implementing it on your own self for 10 minutes, it's going to be a very difficult challenge to do. I've had a lot of clients that actually are doing this breathing exercise, but they don't practice it during the week, and then when they have one, they want to try it, and yeah, it works, but it doesn't work as effectively as I know as it could, as the research says that it does, if they don't practice it twice a day for 10 minutes, even if they're not having one. So that's the key, is to reshape your breathing back and forth. The other thing is that when it comes to thoughts, we'll get that to it, but that's all you're doing. You're changing your breathing in and out slowly.
So 5 seconds, 5 seconds out, 5 seconds in, 5 seconds out, 5 seconds in, and
so
that's
I'll guide you right now. For example, take a slow breath, and this is not taking a deep. This is not a exhaling in. This is a natural breath, breathing in naturally, slowly. And as you're breathing slowly, your abdominal muscles or your stomach is expanding with air.
Okay.
And then you slowly breathing out a count of 5. So the same account you came in breathing, the same account you coming out. See what you did right now? She actually, if you notice, is she took a breath from, and a lot of us we tend to do this because we're used to living in a society where we have to suck in our stomach. Don't suck your stomach, okay? Let it expand. Let it be there for you. It's like little babies. You know, when little babies are breathing, you can picture a little baby on their stomach. Their chest doesn't go up. What goes up when they're breathing?
Their tummy.
Their tummy. And so when you do tummy breathing, so that's what you're doing, you're tummy breathing.
Okay.
And without taking the exhale in, because if you do, they take the exhale in, what's going to happen, you take the oxygen in too quick, you're going to get dizzy. And that's another symptom people fear. I'm getting dizzy. This actually makes it worse for me.
Right.
So you want to breathe in slowly. I'm going to do it. You can't even tell that I'm doing it. You're going to notice probably by my stomach. As I breathe in, if you notice, my chest didn't go.
Right, there was no extreme.
There was no extreme breathing. You could do, the great thing about this breathing retraining, you could do it at work. You could do it if you're doing a presentation. What it does, it activates the parasympathetic nervous system, which is the calming system. Because what happens with a panic disorder, you're actually activating the alarm system of your body. And that's what you have to look at is these symptoms are alarm reaction. So in order to fight that off, you have to activate your calming system, the parasympathetic nervous system. That's what you have to activate by slowly breathing in and expanding your stomach and slowly breathing out. And this is why I tell you that it's really important to go to a professional, because they could tweak what you're doing wrong and fine-tune it for yourself. Because some clients, I time them, because normally when you come breathing, you do 10 to 16 breaths like this, cycles, in a minute. So what happens is I time them. It usually is 10 seconds, a whole, what I call a whole breathing section, which is breathing out and breathing in. That's usually 10 seconds or 1 hour, maybe 8 seconds. And that's why I'm doing the breathing retraining. If you notice the word breathing retraining, you have to retrain yourself to breathe naturally, because when you live in a high panic state, high anxiety state, your breathing has changed. You're gasping for air, and all these different things are happening, and we don't even realize it's even called a tic, because you take and then breathe out, and that's going to maintain the anxiety. It's going to maintain the panic. What's going to happen is going to keep your blood and alkaline level pretty high, which means your blood's going to be very sticky. Like I mentioned last week, you're going to breathe more in, but just because you're breathing more oxygen doesn't mean it's going to get more oxygen to your body. It's going to stick to your blood, and that's what's going to happen. And when you have the CO2 and oxygen at a nice combination, even combination, you don't need to breathe a lot, because what you breathe is actually going to get to your necessary areas, because your blood is not going to be very sticky.
That makes sense.
Mm-hmm. So I want you to try it again to see the breathing in, breathing slow, naturally, but just expanding your muscle, your stomach, and breathing in slowly and gently, and breathing out slowly and gently.
Okay. I think now that I know not to do it suddenly, I can give it a try. Let's see.
That was better. I do notice, what I think I do recommend is, and the reason why I really emphasize this, because this is an important factor when it comes to breathing retraining. I would even take my watch out and I will time you, but one important thing to do is put your hand on the lock position on your stomach area, and as you expand, watch it on lock, as expanding out like this, and then slowly expand back in. And you're gonna notice that if you're doing it correctly, it will slightly expand. Now, there's some individuals, like myself and some others, that we're gifted when it comes to the abdominal area. We've worked on this area, especially the holidays, that we tend to eat a little bit more, so the expanding is a bit more difficult to do, but that's okay. But this is, for some individuals, going to be helpful. Just going to notice as you're putting your hand in your stomach, you're going to notice going up. Even your hands are going to go up or expand, and that's all you really need. So I want you to try it one more time with your hands on your stomach, and we'll focus on this, and I'll kind of time it for you. And I'll tell you go. Ready? Go.
That.
Okay. So how was that for you?
That was better, but I completely can see how somebody's timing or just perception would be off, because initially I felt like I was doing it, at the right pace, and then as we progressed the second and third time, the third time right now felt like a really long time, and it was only 10 seconds.
Yes.
So I can definitely see why it's good to actually go to a professional, or to just really continue to work on retraining, because it's not easy. It seems like it would be so easy. You're breathing in, you're breathing out, but
no, it's a very challenging thing to do, and it's such a behavior that we kind of do that we don't really realize that I'm changing my breathing. And I even noticed you have some tics. So the gasping for air, and that tends to happen naturally, and that's what happens when we have high anxiety, high stress, the need for oxygen comes in, and that's very natural to do. And one of the things to understand is these little tics are sometimes we're going to maintain some of the panic attacks from continuing happening. That's why a lot of times you have panic attacks when you're sleeping at night, when you all of a sudden you wake up. That's because you have these breathing. You're breathing in a way that is shallow, superficial, so often you have these tics that any little change in your body at night or sleeping is going to activate your alarm system to activate. So that's why it's really important to do the breathing retraining twice a day, even more if it's possible, and come back and report. That's one of the things I'll definitely do immediately and try to integrate to kind of show that the effectiveness of this breathing. That's just one of the techniques that is important to actually implement. Breathing in, breathing out. And that's usually very helpful for individuals to kind of bring down the intensity of the panic.
Makes sense. Terrific. So any other special tidbits that you can...
Yes, there's actually another one that I actually want to bring up, is that as you're having these panic attacks, you really have to understand that the reason you're having these panic symptoms is because your body's trying to protect you. It's not trying to harm you, it's trying to protect you from harm, whether it be social, mental, or physical threat, either be real or imaginary. Your brain does not know the difference. If you notice, when you're watching TV and there's a fight, right? Or the scary movie, you're back bobbing and weaving, moving back and forth, your heart's racing, it's like you're sweating, you're in the fight. It's all imaginary. None of that is going on. It's not true, but your body's reacting. Your body's simply gonna react to what your mind has. So what's gonna happen is, if you're thinking what we call catastrophic thoughts, which is you think of the worst possible outcome, and the second part of that is you don't think you have the ability to cope with it, that's going to be a problem. You're going to start having a lot of these panic symptoms. So that means a lot of people say this, they'll turn a little hill into a mountain, making the problem bigger than it really is. And typically, I don't know about you guys, but in my head, things are way worse when it comes to reality. So one of the things you have to remember is that we have catastrophic thinking, is our thinking also will contribute. The easy part of panic attack is treating the physical symptoms. The hard part is the mental aspect of it. And that's one thing I'll want to emphasize later on. But the first thing is, know that your body is trying to protect you. The physical symptoms you have, there's a reason why you're having them. In the first episode that we talk about panic disorders, I describe in detail why you're having the symptoms. So you constantly have to remind yourself, it's not a panic attack. It's my alarm system being activated to protect me. And the reason I'm having the symptoms is because adrenaline, noradrenaline is rushing to my system, making my heart beat faster, to get more blood into my muscles and body to protect me. The reason I'm sweating is because to keep my body cooled down, and also if someone tries to grab me, I'll slip away. The reason I'm seeing blurry-eye vision is because my pupils are dilating, getting bigger, getting more sunlight, and having better 20/20 vision. The reason I'm feeling a little dizzy is because of my breathing changes. A little bit less is going to be oxygen to my brain, which is going to cause a little dizziness, unsteadiness. Nothing bad's going to happen. The reason I have nausea is because a lot of the blood is going away from that area, going to the major muscle when it's needed for protection. So you just understand the reason you're having these symptoms. If you've gone to a doctor, got an EKG, got a checkup, and got a clear bill of health, you're fine. You're not going crazy. Your mind's going to try to invent all these different things. It's not true. You're simply activating the physical alarm system. So this is one thing I tell my clients is you have to give a coping card that tells you exactly why you're having these symptoms and repeat them. So when you're having this, no, this is my physical alarm system, my body alarm system telling me it's going to try to protect me from danger. That's all that is.
I like that. And if they continue to repeat it and repeat it and repeat it, then they won't continue with the catastrophic thinking, because they'll remind themselves, no, this is not what it is. You know, I'm not dying. I'm not having a heart attack. It's nothing extreme like that.
Exactly. And if you need to get out your forms from your doctor that gave you the EKG and report and say, look, at me and my doctor should have a clean bill of health. Nothing's wrong with me here. Because sometimes we need to go through that process of actually getting physically, and I always recommend with panic attacks or any mental health condition, substance abuse, go to a doctor, get a physical checkup, see what's going on with you, and once you've been given a clear bill of health, then you should know, okay, logically speaking, all the evidence there dictates that this is just a panic attack, and my doctor is not really concerned over this panic attack, because we know in the profession that with panic attacks are very treatable, and they're not going to cause you to die or lose your mind or go crazy. It's not going to happen.
Terrific. So is there any other thing that we can offer the viewers to kind of watch out for to help with panic attacks?
Yeah, one other thing that you also want to do is keep track of your symptoms. Write down what caused them, if you think, what date, what time. Try to write down all the symptoms you were having that day so you can see a pattern. Sometimes there's a pattern of what's causing this, and sometimes there's no cause whatsoever. Sometimes it's due because of medical condition, sometimes it's because another problem we might have, but if that's the case, then we treat the medical condition or we treat the other problem, and usually those panic attacks go away. But you also understand what is causing to have this potential symptoms, so you understand that that's also very treatable.
Terrific, terrific. So, okay, so The breathing, 5 seconds in, 5 seconds out for 10 minutes, twice a day, just like a prescription. And then reminding ourselves that it's our alarm system, it's our body protecting us, and kind of reciting or looking back at that clear bill of health and reminding ourselves, you know, this is what's going on. It's nothing catastrophic. It's my body, and being very specific with the symptoms. And then keeping track of everything, so you kind of know what's going on or what's causing that, those tics or the anxiety, right? Is that what we're looking for?
Yes. Another thing you want to add, I just gave you 2 or 3 different interventions to use. Another thing is we have what we call overestimating thinking, because you know, thinking really causes you, or causes me, or all of us in general, to have physical reactions. And so what's happening is you have electrical impulse comes to your brain, goes to your thalamus, makes steel chemical, and then you have this physical reaction that's causing these sensations in your body. So really important to understand that your brain does no difference. You have to talk back to your brain. You have to talk back, give it a name, you know what I mean? I know a lot of clients call it, here comes my stinking thinking, here comes my friend Fred, or whatever it might be. Some people, I have little kids that call it, this is the Grinch, whatever it might be, to understand that this is my negative thinking, or this is my catastrophic thinking, or my anxiety thinking, whatever you want to label it. But understand that we also call it, it's called overestimating. It's a way of thinking that we actually think that something's going to happen when it's really unlikely to happen. I had a client the other day, and he had panic or high anxiety when it comes to driving because he was in a car accident. We broke down. He says, you know, Edgar, it's a 50-50 chance out there in the streets. And I looked at him, and I'm like, okay, well, let me see if that thought is true. We actually examined that thought. It's called overestimating. He really thought something was going to happen, which likely is not going to happen, but there's always a probability. And so we did his numbers. He's been driving for over 15 years. He drives every single day. He's only had 2 accidents. He had like a 0.002% of getting in a car accident.
That's amazing.
So one of the things is understand that sometimes our thinking lies to us, and a professional could help you how to fight these thoughts. We have catastrophic thinking of the worst possible outcome, overestimation, and we call it selection abstraction, which means we just selected one section of whatever happened, we focus on it. And that's what he was doing. As he was driving, he saw 1 car accident, 2 car accidents, 3 car accidents, 4 car accidents in one day. He said, see, Edgar, that's my evidence. I go, how many cars you seen that road that day? Oh, over thousands of cars. I go, exactly. So sometimes we focus on that. And then the worst thing is he saw his friend. He's like, oh, man, I got a car accident the other day. And all of a sudden, that's what happens. One thing you have to understand is that it's like when you buy a new pair of shoes. You love your pair of shoes, but then all of a sudden you look around, everyone has your pair of shoes. That's the way this works out. Your mind's going to find what it's looking for. And that's the hardest part of this panic attack, is fighting off these distortions that we have in our head. There's a lot of other distortions, but those are the 3 ones that I see when it comes to panic disorder. It's really important to understand. Another thing that I have my clients do is what we call interceptive conditioning. And what I have them do is I have them run in place for 30 seconds, and make them have these symptoms. I have them do push-ups, keep muscle tension, and this is kind of to let them know little by little these symptoms are okay and they're safe. There's also what we call do a scale of things you avoid, and little by little start doing those things, because what happens with panic attack, whenever you have a panic attack, you associate whatever you're doing with the panic attack, and little by little you start doing those things like stop drinking caffeine, maybe stop drinking alcohol, whatever it might be. So that's one thing important to understand, is that little by little you're going to have to make a list of things you're avoiding and do them little by little so you get your life back. I mean, there's a lot of things we tend to do with panic attack, so it's really important to go to a professional. And ask this professional how long you've been treating panic attacks. What is your success rate with panic attacks? What are your typical complications with clients? Because it's really important to get the help that you need is out there. At Crossroads Recovery Centers, we will provide you with this service. But not only us, we have a lot of other clinicians, or you might know different clinicians that might be able to do some cognitive behavior therapy, which looks at your thoughts and behaviors and able to do this. I'm not saying that CBT is the only way to go, but I'm saying CBT actually is very effective to treat panic disorders. Also look for a psychiatrist that might give you some medication that might help you for maybe some anxiety or depression. That's also an avenue to take. Crossroads Recovery Center, we have the same philosophy that we like to treat the mind, the body, and the soul. So understand that also. that there's treatment out here, and this is some of the things you could do to improve your panic disorder. And some people actually get mad at me. Can you believe that when I tell them you actually get better in a few weeks? In less than a few months, you'll be well with a panic disorder. They get mad at me. They're like, Edgar, how can you tell me I'm gonna get better when I've been like this for 10 years, 6 years? Because the research indicates that people typically go years before they actually get help, and they struggle with this. So really important to understand, if you have a competent therapist that has experience doing panic disorder and actually enjoys treating anxiety disorders, yes, some therapists enjoy treating anxiety disorders, you're going to have a pretty positive outcome.
Terrific. There you have it. So if we follow the protocol, and you, especially if you get help, like you said, if not from Crossroads Recovery Centers, then from another mental health professional, you can definitely be on your way to either at least lessen, you know, the amount of panic attacks or the severity of them, if not completely rid yourself. Don't shy away from getting help, because like you heard Edgar say, it's possible no matter how long you've had them or how severe they are. So Edgar, once again, thank you so much for joining us today and all the information that you've provided us related to panic attacks. We appreciate you being here.
Well, thank you very much for having you. And anyone out there, I do want to wish you happy holidays, happy New Year, safe New Year. And I know a lot of people say, you know, my New Year's resolution is to get my panic attack or get some help for whatever I'm going through. Don't wait until New Year's. Why wait tomorrow what you can do today? If you're really suffering with panic, obviously if you're watching the show on panic attack, you might know someone, or yourself are struggling with a panic disorder. Get the call today. You know, give us a call. We'll talk to you over the phone. We'll link you to someone that we know that might provide you services in your area. If not, we'll look for you. I mean, you don't have to do this on by yourself. You don't have to come to Crossroads. Just get the help. The reason we're doing this show is to actually educate you that there is hope out there. Because sometimes when you have panic disorders, you lose hope. Little by little, your world starts becoming smaller and smaller and smaller. Can't do the things you enjoy doing with your kids. So we want to give you back your life. And hopefully you found this very information really helpful. And once again, you give us a call, Crossroads Recovery Centers, or you know, call your own insurance provider and get the help that you need.
Terrific. Thank you for joining us again, Edgar. Everyone, thank you for joining us. Thank you for watching. Have a great night, and God bless.
Do you have someone, a loved one, that you care for, and you're seeing they're struggling with an addiction to alcohol or drugs, and you've been attempting to look for answers, for treatment, and you've been looking online, and there's a lot of resources out there with programs with 20, 30, 50 beds, and somehow they might get lost around in treatment? Look no further. Please call at 877-293-0722 or visit the crossroadsrecoverycenters.com. Once again, the number is 877-293-0722 at www.crossroadsrecoverycenters.com.